and what are all the things we can do. The other important message I want to mention, the United Nations 2 weeks ago on September 19th and 20th, a month ago, declared that the non-communicable diseases are the new global health emergencies. This is only the second time in the history of United Nations that the General Assembly has been called for a health-related issue. The last time was 11 years ago when they declared the HIV as the global emergency, and there was a lot of emphasis. The aid agencies started funding those, and there was a dramatic impact. I think we should congratulate the WHO and United Nations for drastically bringing down the HIV/AIDS burden. So this shows the importance of NCDs. All these years, countries like India and lower middle income countries used to think that we should control the infectious diseases first, or maternity and perinatal problems first, before we handle the non-communicable diseases. But unfortunately, countries like India and other low and middle income countries have a double burden. We have the infectious disease on one side and the non-communicable diseases. So it is not possible for us to control the infectious diseases first and then come to the non-infectious diseases. And some people even went to the extent of saying this is a tsunami in the making as far as health is concerned. Some more statistics, by 2025, India will have 87 million diabetic patients. India will have 212 hypertensive patients. That means 1 in second or 1 in third adult in Indians will have either a blood pressure problem or a diabetes problem. Surprisingly, these 4 groups of diseases, the cardiovascular diseases, cancer, lung problems, and diabetes, even though they look completely separate, the risk factors are the same actually. High blood pressure, high blood glucose, high cholesterol, lack of physical activity, and eating unhealthy diet. So the risk factors surprisingly are the same. If you really go back, it is the globalization, the modern way of life which is pushing these risk factors. So the message of these NCDs is there is no need to try to prevent individual diseases. If we just control the physical activity, make people more active, make people take a healthy diet, stop smoking tobacco in all aspects, chewing tobacco, smoking tobacco in all aspects, and controlling alcohol. If you can control these 4 risk factors, 80% of the premature non-communicable disease can be prevented. So in fact, it makes it easy actually. And the second reason why we started the workplace illness is 60% of the adults spend 8 hours a day in workplaces. So the risk factors are the same. The risk factors can easily be targeted. Workplaces is a time where majority of people spend their lifetime. So workplace, United Nations, WHO, World Economic Forum has strongly recommended that workplaces should be used to target NCDs and NCD prevention. With this message, we are talking at this stage of a health disease prevention. I think we should even go a step backwards or a step forwards, whichever way you think, and start promoting health